Hello, I am Dr. Abhijit Roy, practicing currently in Kolkata. Our today's discussion will be what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure. But what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of blood vessel. This is called as blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices and, for example, not having enough regular physical activity, obesity, smoking, and stress. There are other risk factors that can also increases the risk of developing hypertension, such as age. As people gets older, the arteries can stiffen up and narrow as excess fat builds up. Family history of high blood pressure. Excess salt intake is also known to raise blood pressure. Not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty foods increases fats throughout the body and makes the heart work harder to push blood through the body, hence causing blood pressure to rise. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious sign and symptoms. That is why it's often called as silent killer. It puts people at risk for several diseases from cardiovascular problems to kidney failure, stroke and even eye damages and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether person have high blood pressure or not. Generally, when symptoms do occur, they include morning headache or tiredness, vision changes, buzzing in the ears, fatigue, nausea or vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called as sphygmomanometer. A blood pressure is recorded in two numbers, one is systolic and other one is diastolic. A healthy or normal blood pressure should be lower than 120 by 80 mm of mercury. Here the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between the beats. If blood pressure level is more than 140 by 90 mm of mercury, then the person have hypertension. If person have BP levels higher than this, then he or she might at risk of developing serious heart diseases. The risk can be prevented and reduced by taking steps towards a healthy lifestyle such as regular exercise, healthy diet, quit smoking and reduced alcohol intake, regular blood pressure monitoring, stress management, adherence to medicine. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid, delay or reduce the need of medication. So let's take a look at these strategies one by one. Regular exercise or physical activity. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So, if the heart has to work less to pump, the force of the blood vessels will decrease, lower the blood pressure. Now, number 2 is healthy diet. Diet also plays an important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through the dietary intervention, one can adopt a dietary pattern such as DASH diet, eating less saturated fat and total fat, getting plenty of potassium in diet, limiting the amount of sodium in the diet. Now about DASH diet, that is rich in whole grains, fruits, vegetables and low fat dairy products and schemes on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter of mercury if having high blood pressure. Reduced sodium in diet is also reduces pressure by 5 to 6 millimeter of mercury. Now number 3 is smoking quit. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce the risk of heart diseases, improve your overall health. Number 4 is regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often I advise patients self-monitoring of their BP levels. Self-monitoring helps person to measure BP at different times throughout the day over a longer period of time. It also assists doctors to get a more complete picture of person's blood pressure reading at different times. Further helps us better prediction of cardiovascular morbidity and mortality rather than a single routine blood pressure measures that occurs during a clinical visit. Number 5 is stress management. By learning how to relax and manage stress can improve emotional and physical health and lower blood pressure. Stress management techniques include such as exercising, listening to music, focusing on something calm and peaceful, and meditating. Number 6 is adherence to medicine. A medicine to lower blood pressure may be recommended by a doctor if your blood pressure is consistently high, usually at or above 140/90. Adherence to medicine is an very important part that controls blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.